Let me show you some ways of how you can study smarter in nursing school, and it's way better than looking at your PowerPoints trying to put items together. Let's look at some better ways. I really love concept maps. In fact, I did a research study on this very subject when I was in graduate school trying to figure out how to be a great nursing instructor. So, what I found in my research was that students who were creative and that made concept maps just like the ones you see here or some other variations that I'll show you in a minute, they retained knowledge much better than students who did not use concept maps. So it has been researched and studied. So one thing about these concept maps that work is that they are colorful. There are creative, looky here, creative drawings, little doodles. I have like different ways I organize information. This works, you guys. Use little symbols that helps you remember things easier. Like I really love up and down arrows for high and low values or greater than and less than values. That's better than just writing it out. So use your shorthand stuff to help you kind of pinpoint down, make your notes very narrow. Don't use so much information. Use bullet points, keep it simple. That way you're not overloading yourself. Let's look at another example. Here's one I did on jaundice and hepatitis. As you can see, I have them on the same page, and that's because this concept is very much related to each other. Hepatitis, one of the main symptoms that we're going to see is jaundice. So I have my jaundice up here first, and I have hepatitis on here second, but they are all on one page, which I love all on one page things because I have everything that I need right there in front of me on one page, and I'm not flipping through 1,500 pages of PowerPoint slides to learn a subject. That's just not going to work. It will not work doing that. And if you have learned that it doesn't work, it's time to do something different, like making a concept map. I even drew my titles really cutesy, and I have some vocabulary on here. I have little pictures like eyeballs. Make it creative. Make it cute. Make it fun. Use different colors. This way, you're creating memories for your brain. Now take a look at my really complex liver disease cirrhosis paper here. This is everything that I want to remember about liver cirrhosis. One good memory trick is to, when you make these concept maps, what you can do is go and make them and then take you a blank sheet of paper and see if you can recreate your concept map without looking at the original concept map. So can you replicate what you wrote? What did you retain from that? When you do that, you will start to realize what you don't remember about that disease. Okay, sometimes that's called like a brain dump. You can dump everything you know on a piece of paper and then see what's missing. What do you not remember about this disease process? In the same way, you need to understand what you're writing. So if you do not understand what telangiectasis is, and here I drew a little spider because that helps me remember that this is spider angiomas, like spider veins, and telangiectasis is the medical terminology for that. Okay, if you don't know what palmar erythema is, you should be looking it up and seeing if you can understand what it means. Why do we have this symptom? Okay, so you can't just write a list and then memorize the list. You have to understand what you're doing as well. So make sure you have an understanding when you're writing something down. If you need to make a note next to it, maybe I'll draw a palm that's red right here, a hand that's red, and that would help me remember that that means a red palm. Here's another concept map I drew on postpartum care. This one has a mnemonic on it, bubble L-E-L-E. Okay, so lots of different disease processes has really cute ideas for mnemonics to help you remember signs and symptoms or nursing interventions. Okay, well use those to your advantage. Write them down on a blank sheet of paper, draw it out, make some pictures, use different colors. I've got some like important things here in a different color. I want to make sure I remember those things. In one of these sections, I have another acronym called RITA. It helps me remember the signs and symptoms of or how to document my episiotomy site. I need to document if there's redness, edema, ecchymosis, discharge, and what are my edges approximated. This is what I'm checking here. I got a little check. I'm checking for Rita when I'm doing my episiotomy assessment. Okay, so over here I've drawn pictures of a postpartum belly and I'm drawing like what I need to be checking. That gives me a visual hint that when I'm doing my fundus checks, this is what my brain is thinking and picturing in my mind what's going on when I'm doing these assessments. So use your acronyms, use your mnemonics, draw pictures, use color, be creative. Here's another method that you can use. This is a blank concept map that you could create something just like this in Canva or Word document or GoodNotes or whatever electronic program that you like to use. But be cautionary if you're using something that looks the same for every single disease process, because then you are teaching your brain that this color is consistent with every single disease process that you do. So if it works for you, great. But if you need something different to trigger your mind to understand and remember a different disease, then maybe each map needs to look different. But these are great to use in class while you're taking notes, and helps you organize different sections of each disease that you need to remember, like the medications that you're going to use for this disease, nursing care, the labs that you need to monitor. This helps you organize that information off of the PowerPoints if your instructor is using PowerPoints, and puts it all in a nice little pocket for you on your desk. And it gives you something to do in class while you're trying to learn a concept. Okay? Here's another idea, if you're a digital type person, is to make your own concept map. This one was made with Word documents, Microsoft Word. So you can create your own. You can make different boxes, you can different colors, you can label them differently, you can copy and paste different pictures in here, you could probably draw arrows. You just have to make it your own. Here's another example of just using different colors, different sized boxes, just different methods of putting it together. So here's a blank one. So if you like this, you can make one yourself, bring it to class, use it in class, and use it to take notes. Then you would have one sheet for each disease that you're doing in class, where you've written down the patho for that disease, you've written down the diagnostics, you've written down the signs and symptoms, treatments, meds, nursing care, anything else you need to know that your teacher is going over with you, you're writing it down. You're writing it down in class, then take it home and make it better. So add to it, organize it better, revisit, relearn, expand on things that you didn't understand, highlight things that are important that your instructor said, you better make sure you know this, okay? Here's another example of something else you can do, and that is table making. So you could make tables. This one was made with Word document, of course, and you can use it when you have things that are very similar that are hard to differentiate from each other. For example, these are neuromuscular diseases here. I have MS, I have myasthenia gravis, Guillain-Barré, ALS, and Huntington. So these are all different neuromuscular diseases with similar pathologies and similar symptoms. So how can I differentiate between them? Well, if you watch my other YouTube video, I show you how to fill this table out. So it will help you when you can underline the things that are different or highlight that makes each one special. Here's an example of filling one of those tables out. So this one is about pediatric communicable diseases, and here I just have where I have written out what the diseases are, the common names, the signs and symptoms. The signs and symptoms here are abbreviated because a lot of them are very similar. So I have a little cheat code up here, the key for what these symbols mean, and then I just have written in all the important cliff notes about each disease. So The moral of the story is to be creative, to do something with your brain to create memory. That's what you want to do. You want to create memory and understanding. So, can you create something that your brain will be like, you know what? I did learn that and I wrote that down in this little bubble on this page, and it was red, and I underlined it because it was important, and can I remember what it was? And most of the time, if you were creative in how you process that information, it will come to you. But if all of your notes look exactly the same, then it is going to be hard to recall that information. But more than recall, you need to understand what you're writing down. So, in other words, you need to be able to teach this to someone else. Can you take what you wrote on your concept map, and can you teach your family about this disease without looking at your concept map? Or maybe you use it to prompt yourself to remember because you are just beginning, but you should have some sort of understanding for each disease. So look at this down here, the late decompensated liver cirrhosis. I have pictures, I have all kinds of things, I have a long list. And if you can understand why someone has pruritus when they have liver disease, well, it's accumulation of bile salts in the skin, then maybe you want to understand why there's an accumulation of bile salts. So take that deep dive into true understanding. Why is there ascites in liver cirrhosis? Well, there's a third spacing of fluid. Why is there a third spacing of fluid? Well, I'll give you a hint. It has to do with albumin. So why don't we take some time to also understand our pathophysiology? Because if you can understand it at a deep level and take the time to understand it in your anatomy, pathophysiology level, the symptoms make sense. And then it makes more sense. And then it makes more sense for the interventions that you're going to do as a nurse. So I hope you have enjoyed this video, and I hope you take some of my hints, tips, and tricks, memory tricks, to heart and start getting creative and having an arts and craft party with your classmates.